Expectations are such an important aspect in medicine because expectations influence how a doctor and a patient relate. When a patient walks into my room, I'm already aware that this patient is walking in with a certain expectation. They're expecting me to be professional, they're expecting me to be courteous. They've got all those finite, limited expectations for the moment. But there's an underlying, bigger and deeper expectation. And that is this doctor going to be able to manage my problem and sort it out the way I expect or I anticipate it to go? So this is the drtebz diaries, and this is what we'll be discussing today: patients' expectations. So, I've realized that, expectations have such an amazing influence on my relationship with patients, as well as any other doctor-patient relationship, because it is that thing that will determine whether this patient sitting in front of me is, number one, going to trust me. Number two, if this patient is going to continue on the journey with me or with the doctor, or they're going to sever the relationship and say, "Oh, doctor, I want a second opinion. Thank you very much for assessing me, but I think I want to go elsewhere." Expectations. If I, as a doctor, or any doctor meets that expectation, then it's great. But what happens when that expectation is not met? And so I want to address that part because that is so important. So I think when a patient comes in, their expectations have already been set, number one, by what they've already read on the internet, what they've researched, what they've heard their relatives and friends have advised them, or what experience they've had with a similar condition or symptom or sign, And also they have that hope and fear. So the fears also inform their expectations. Their skepticism about the medical system or about the doctor or about the confidence they've heard about the doctor. All those things are informing the expectation. Okay. But one thing that patients are not aware of when they walk through the door, or they don't acknowledge it intentionally, like sit down and actually acknowledge it. The number one, they don't know. You as a patient don't know the medical knowledge. It's amazing when you know and understand the intricacies of medicine. All of a sudden, your expectations meet reality. When you don't know medicine in its depth, your realities, your expectation doesn't meet reality. It's like a child who wakes up in the morning and they're like, okay, you know what, today I want to go to America. I have this expectation, I have this dream, I am anticipating this thing. But a child doesn't understand that you actually have to buy a plane ticket. And how much is a plane ticket? And all the planning that goes through going to America, because you have to plan where you're going to stay, where you're going to live, how much money you're going to spend there, the clothes that needs to go, the people you're going to meet. They don't see that, they don't consider all the other factors that play a significant role in this whole journey. Going overseas is not just going overseas. There's a lot to consider when you're going overseas. Similarly, with medicine, just treating, it's not a simple thing. There are many things that play here a role in this. So I want to outline those factors now. So number one, the one thing you're not considering is your age as the patient, the physical condition of health. All that is a major thing in outcome. For example, it's like a patient who is 30 years old who falls down a flight of stairs and breaks their wrist versus a 90-year-old who falls out of bed and breaks her wrist. Very different. A 30-year-old is going to heal way better, far faster, and literally have like a proper, journey in healing, versus a 90-year-old where the bones are already frail. It may take longer for the bones to heal and so forth, and the tissues and so forth and so forth. So the age of the patient, very, very important. And the health condition, very important. The second thing you're not considering is how far the medical advances have come in that area or field of medicine in terms of management. So you're expecting this a miraculous thing, but that miracle you're waiting for hasn't occurred. You know, it's like when a patient says to me, doctor, if you remove this eye, and you put the artificial, am I going to see with that artificial eye? And I have to say to them, no, you can't. You won't be able to see with the artificial, because medicine hasn't advanced to such a place where we can transplant eyes and put out an old eye and put in a completely new eye, and you see with it. Medicine hasn't advanced to that phase, you know, to that stage yet. And so you're not considering that fact. The third thing is, even if medicine has advanced to that phase to that stage where you have these amazing miracle drugs that can do all these things, but in your health facility, in your place, in your country, is that available? It may not be available. There are some medications that do amazing things that are not available in South Africa, either because of politics or finances, that the drug is just way too expensive, and you're in a government setting and the government is like, look, we can't pay 60,000 Rand every month for your drug when we have to share resources with everybody, you know. So all of a sudden it's like, okay, so now you as the patient want the drug, but also your resources, you don't have the money to get this medication. So then you can't, your expectations can't be met, because you don't facility, baba, can't afford it, you know. And then the fourth thing that you're not considering is the medical expertise that is available to you. You know, the junior doctors, the senior specialists, the different types of doctors. And maybe where you are, there is no specialist that you have. So your expectations can't be met because it's not there. It's not available to you. This person that you need, the specialist that you need is not there, or the specialist who is there hasn't attained the skills as yet. They still need to go for training to get that skill. So do you see how there are all these factors that play a role in the situation? But as a patient, you walk in and you just expect an ideal situation. But that's the problem. We live in a non-ideal world. And so, yes, there's some places where, look, the money's there, the patient is perfect, and, you know, the doctor is there and everything can go well. Oh, yes, and the other factor, number 5, is the stage of the disease. So you walk in and you think, okay, they'll be able to cure this thing. But no, they can't cure this thing. The illness is incurable. Or the disease is so advanced that you just thought it's going to be a small little cut, and you walk out the door and it's gone. And you're gone, you're done, relationship, move on. But actually, no, the doctor's like, no, this thing is small here, but there's a possibility it might have spread to nodes here. So it's not just a small little operation you have to cut here. We also have to go into your neck and dissect some of the lymph nodes out and go and and go test them to see if this hasn't spread to here. And all of a sudden you're thinking, my goodness, this thing I thought was so small, but it's so big. So the stage of the disease, the nature of the disease, all of that plays a role. So, you know, when now a patient is told that your expectations are not going to be what you anticipated, or the outcome is not what you anticipated, then there's several outcomes because of the patient. Now the patient, you as the patient. If you're an open-minded patient who comes in and says, you know what, I'm here, I'm willing to hear what the doctor says, I'm willing to work with this doctor, I'm willing to find a way, you know, I'm open. Then yes, the relationship is going to continue, you're going to work nicely, and, you know, step by step, you continue. But if you're a patient who's very closed-minded, and you're like, I want my way, I don't want to hear anything else, I've heard these sort of testimonials about this, and this is what I expect. I'm not willing to have anything else. So two things are going to happen. You're either going to be very disappointed and despondent, and you're going to go into depression because you're not in control. You're realizing it. I am not in control, and you go into depression and you just feel like, you know what, you're despondent. Or you're going to be very angry and very frustrated. And you're going to be like, no, doctor, I don't believe you. I want a second opinion. I'm out the door. And that is it. And look, as a patient, you have every right to want a second opinion and to look for a second opinion. That is it, So those are the different things. And then you've got I call it number 3. Okay, the number 3 is a patient who's nonchalant, chilled. It's like, Bona, I am whatever goes. Doc, you say I do, we move, That is not good either because you're over trusting. You have to apply yourself to what's going on in the situation. You have to open your heart and be like, look, I want to understand. I want to own my health. So number 3 is not good either. Number 2 and number 3 are two extremes that are not healthy. Number 1 is the one where you're open-minded, you're thinking soberly, you're researching, you're hearing the doctor, you're working with the doctor, and Bona, you're moving with it. Those patients tend to do better emotionally, psychologically than the other 2 types of patients. So that's what I wanted to talk about, to say, as a patient, more than anything, even myself having been a patient, you have to realize also that the doctor you're dealing with is human. They really are human. And as a human being, you aim to do everything with perfection. But there will be that 1%, 2%, 5%, 15% of the time when it doesn't work out perfectly. Not because of the doctor, but because of this whole situation that it's just not perfect. And even as a surgeon, in my hands, I know the type of results I can get. And I have that confidence when I speak to a patient to say, you know what? Yes, I'm going to lift the lid. We're going to get the contour right and so forth and so forth. But there will be those moments where it doesn't turn out that way, either because there's too much bleeding, because this has happened and so forth and so forth. There's issues and matters out of my control. And so as a patient, you have to understand that there's this human being who's sitting in front of you, who has the best of intentions to help you and to get you across the finish line of this journey with the best outcome, always with the best outcome. But your expectations have got to be managed by you. And you have to hear what the doctor is saying. You have to understand. Don't try to fit medicine into your box of expectations. You'll be very disappointed. You have to understand that this is what is available. This is medicine. And I have to hear things. I have to manage my expectations accordingly and work with the doctors, And I'm speaking in an ideal situation with doctors who are being open and honest with you and informing you fully of what is happening. I'm describing that form of patient-doctor relationship, So may we all be patients. May we all be patients with expectations that are reasonable and are equal with reality. Okay, so with that, I want to say thank you for listening. And, take care of yourselves, take care of each other. And remember, your health is in your hands. God bless.